muscles in my bicep, like blowing up.
Yeah.
I feel I'm getting really trying to like pumped up without really doing much effort here.
That's the point. In this video, I'm going to explain to you how to use the arm bands and how to use the leg bands. Once you order your KAATSU, you are going to either pick a small, medium, or large band. You want to measure the size of your arms, so you need to take a tape measure and measure the upper arm. So right where your armpit meets your shoulder, you're going to take a tape measure and you're going to measure that circumference. You're also going to take the circumference of your thighs. So you want to take your upper thigh where your leg meets your pelvis. So as high up as you can, you take a tape measure and you wrap it around your upper thigh and you see how wide that leg is. You're looking at me like a dog.
Well, my arms were big one time, and now they're not.
Once upon a time ago, your arms were huge. Steve here, we're going to look at his arms. And so right about there. Okay,
big, huh?
So right up in there. So I don't have my tape measure with me, but we're going to go ahead and use a large because he's a big guy.
There you go.
That's right. When you order your KAATSU cycle, you're going to get your bands in a bag similar to this. You take your bands out of your bag. And it's very important to become familiar with the band. There's a few parts here that may be a little confusing, and so that's why I'm going to explain to you the best way to put them on yourself, put them on other people.
So I should be able to put these on by myself after you show me, right?
Yes, sir. The goal is to teach you how to do this to yourself. The KAATSU bands are very well engineered. They're elastic, they're not rigid, and they're narrow. The upper arm band is going to be a little bit smaller than the leg band, but they're both fairly similar. There's a rubber bladder on the inside that when it swells up, it puts pressure on your limb. Now, you want to start with your non-dominant side. So, Steve, are you right-handed or left-handed?
Right-handed.
Right-handed. Okay, so we're going to start with the left side. So on the bands, there's a left and a right. It also is a small, medium, or a large, but this one is the left. What I'm going to do with Steve is I'm going to get his left arm, and I want him to be nice and relaxed. You want your muscles to be relaxed when you put the bands on. Very important, you want the hose to be pointing down towards the hand. If this part of the hose is pointing up, it may kink, and that may impede some of the airflow into the bladder. So it's very important that you have that little piece going down. You want to put that little piece right there where the tube connects on the side of the arm. You don't want it on the front, you don't want it on the back, you want it towards the side, so when you do your exercises, that doesn't get in the way. You don't want the bands directly on the skin. If it does, it's not a big deal if you're swimming or something like that, but it may cause a little bit of an indentation from the buckle itself. Left side on there like that. And now we're gonna pull that tight. You want to get one finger between the band and your subject's arm. This is called the base pressure. So this is the base pressure at which you're gonna tighten that band. One finger's width, a little snug, pull that tight, and then you wrap that around and make sure it's under there. You can adjust it close, say, hey, how does that feel?
Feels great.
Now your first time, if you look at your hand, you'll start to notice changes in coloration. Now, very important to note your capillary refill time. If your capillary refill time is greater than 3 seconds, then you need to take it off and give your arm a break. Your capillary refill time is when you press down into the palm of your hand, you'll see a little bit of whiteness occur and then it'll come back to pink. If it takes longer than 3 seconds for that white to turn back to pink, it's too tight, you want to take it off, take a break. Now that we have the left arm band on, we want to put the right arm band on. The KAATSU is made to do both arms at the same time. It's more of a full body exercise as opposed to a specific muscle exercise. Make sure that little tube is pointing down. Again, if it's pointing up, it's going to kink. And we want the arm fairly relaxed. So I'm going to have Steve rest his hand either on his thigh, on my thigh, on your shoulder, wherever you want to do, but you want to get that person to relax. This is supposed to feel good. This is not supposed to be painful. So take the band, make sure it's pointing down. I'm going to slip this underneath his armpit. I'm going to go up into his armpit and thread the strap through the buckle. You want it below the shoulder muscle and above the bicep muscle. So where this muscle on the front of your arm is your bicep, you want it just above that. You don't want it pressing down on the bicep. You don't want it in the elbow. You don't want it anywhere other than up into the armpit. Pull it to where you feel a little snug, and then you wrap that band underneath the arm and in onto the other piece. Now sometimes the clothing may get in the way and you may feel some tugging or pulling, so you may need to align that band strap right along there and free up any sort of clothing that may get caught in that band. So after you put the bands on your subject, ask them to move their arms around and see if everything's okay. It may feel a little uncomfortable at first, right? So you may need to adjust a little bit. Sometimes it may be a little low, sometimes it may be a little high. Now that we have both bands applied, now you can apply the cycle.